When it comes to transgender issues, there's no neutral ground. People are either respond with anger or intense defense of it. And this makes sense because while we'd like to think it's not a big deal and it's just another medical issue, the truth is it isn't. Well, today we're going to talk with Irene Ericksen from the Institute for Research and Evaluation and MaryAnne Mosack, president of Ascend. We're going to put aside religious, moral, and ethical considerations for transitioning kids and deal directly with the medical aspects of it. Irene Ericksen is a researcher that works for the Institute for Research and Evaluation. Her job is to review hundreds of the best medical papers on any given topic. We presented her research today on transgender and kids, and her paper that we reviewed is Transgender Research, 5 Things Every Parent and Policymaker Should Know. MaryAnne Mosack is the president of Ascend. It's a nonprofit organization that equips and unites the national sexual risk avoidance field to empower youth to make healthy decisions about sex, relationships, and marriage. SRA, Sexual Risk Avoidance, is an approach to sex education based on primary prevention, an established public health model used to promote wellness and eliminate risk. We're going to be addressing transitioning children, not adult. I think it's very important to understand what the medical data shows about transitioning kids. Here's our conversation. Well, I've been looking forward to this podcast for a long time because we're going to be talking about transgender and kids. And I have 2 fabulous experts today, and I welcome them each to the podcast, Irene and MaryAnne. Thanks so much for joining me.
It's a pleasure.
Thanks for having us.
Irene, I want to start with you. You're a researcher, and you have looked at the papers and the research that have been written on transgender and kids, gender dysphoria, and so forth. Can you describe what the process of transformation that a child goes through is? Because I think a lot of times parents are like, well, just take them to the doctor and they get a couple shots and they're done. What actually happens when a child goes into a clinic and is going to wants to transition?
Well, of course, that would vary by clinic and frankly, these days by country, because in the US, there is a much more aggressive approach taken to quote unquote, treating gender dysphoria or gender confusion than is actually happening in other countries now. What is happening often in the US is that a clinician would, probably a psychologist or someone, or it could be a medical person, would meet with the parents. And I don't know the details of the various, types of protocols that are in place in these different clinics, but the basics are that they would be encouraged to do what's called social transition, which is to let if it's a boy, dress in girl's clothing and take on a girl's name, and then for children. And then as soon as they begin the process of puberty, they would be put on what are called puberty blocking hormones that would suppress the natural formation of, breasts and genitals and things. And then they would be transitioned when they're a little older, but could still be, teenagers, certainly minors, to gender cross-sex hormones, which would be testosterone for physical girls and different kinds of estrogen, preparations for physical boys. And then they could eventually end up having surgery to remove body parts. So that's what's happening today. This was not always the case.
Really seems like it's exploded from, say, 2016 to now. Honestly and truly, I've been practicing for 30 some years, and I think maybe in 25 years, I saw one genuine transgender child. But something happened in the US and there was an explosion. And we'll talk about that a little bit later. Why does the US approach it differently than other countries?
That's a great question. That is a great question. And in fact, it's political, is my observation. It's not based on the science. In fact, the United Kingdom had the largest pediatric gender clinic in the world, the Tavistock Clinic, and they commissioned an independent review of the research evidence about this kind of protocol that I just described, and what were the effects, and what was the evidence, how good was the research evidence in terms of quality. And based on their review, just in the last 2 months, they have done a 180-degree turnaround. They've closed that clinic, and they have said, we do not recommend, this is the National Health Service in Great Britain, we do not recommend social transition for children, and we are not going to prescribe puberty blockers or cross-sex hormones or surgery for minors unless they are part of a study we have approved that is set up to evaluate the effects. And this same kind of a cautionary approach is seen in Sweden. Just to quote you what the Swedish National Board of Health says, for adolescents, the risks of puberty suppressing treatment and gender affirming hormonal treatments currently outweigh the possible benefits based on continued lack of reliable scientific evidence concerning the efficacy and the safety of both treatments. So the US is really out of step now with what's happening internationally. And, it does beg the question of why.
Did the UK and other countries begin transitioning kids sooner than we did? I mean, are they quote unquote more advanced and they've learned more because they've been at it longer?
Well, the Dutch did start this. They were the pioneers. And then it spread, I think, in Europe, maybe faster than here. I'm not really up to speed on that history of it, but that is my impression.
I think it began in the 80s and 90s, that they began that in the Dutch countries. And I would like to add, I think it's interesting that, Dr. Meeker, you've been practicing for 30 years and you saw one, right? And we have this explosion. And I thought your question is so good. How did United States become, such a hotbed, really? And I would argue that it has been very incremental but deliberate. And with the whole woke movement, it kind of has opened the floodgates of academia to embrace this, the whole cancel culture. And so not accepting anything, anyone's sexual proclivity is seen as grounds for being canceled. And so that means we've done more accommodation for this. And there's all kinds of implications for this, but I think that's a short answer too.
So basically you're saying, MaryAnne, it's kind of social engineering.
Absolutely social engineering. I think we've been taught, we are told daily what to think and how to speak about issues of sexuality.
There's also strong evidence about this issue of, nurture or nature, biology versus environment. And the research with, say, for example, identical twins, 40% of the time where one is transgender, the other is also. That's a very high correlation. It's certainly way higher than random, but it also leaves 60% of the time where it's not happening and where other factors are in play. And those are environmental and social influence. And we see this in the rates that have changed, as you said, Dr. Meeker, dramatically in at least the last 10 years at most, I would say the last 10 years. It's been, 2015-ish. Depending on whose measure you use, 900% increase, 1,500% increase in one of the European countries, 5,000% increase in the UK in teenage girls' rates of gender confusion. That is way, that is a tidal wave. That is extraordinary. And it really speaks to social, what they call social contagion. And, some argue, well, it's just because we've now become more accepting. And so this has opened the floodgates and everybody's feeling more comfortable. But if that were the case, the rates for boys would be skyrocketing like the girls, and they aren't. And the rates for younger, kids younger than teen would be going up as well dramatically, because parents would feel more relaxed about bringing their kids in to be diagnosed and everything. And that's not happening. And one of the interesting things in one of the studies I looked at is that they actually reported that females, girls, were more susceptible to social influence than boys in their study. And this seems very consistent to me with the pattern we're seeing. And this is worldwide. It's not just in the US, it's worldwide that this rate, I mean, the trend line goes like this, okay? If you plot it on a graph, it goes like that, with the dip being at about 2015.
Mm-hmm. So there are more girls wanting to transition to boys than vice versa.
Well, and that has flipped. It used to be that this was primarily a male thing that happened with little boys when they were even, 2 and 3 years old, and then played out as they were older. And now it's flipped, and there were very few girls. Now there are maybe as many as 2 to 7 times as many girls as boys, again, depending on whose measures you use. And the other thing that I think we have to say at the outset, and then I'll stop talking so much, but that if you let this play out naturally for children that present as gender confused and say, I'm a girl, a little boy that says I'm a girl, if you let this play out naturally without the social transition and giving them a dress to wear and a girl's name and everything, 80%, 4 out of 5 of those kids will resolve this confusion to be consistent with their physical biology by the time they're young adults. But we can't predict who that one kid out of 5 is that is going to persist in his transgender identity. We don't know when they're 5 who that is, but we do know that if you start them down the path of social transition and then puberty blockers, they will almost without fail proceed on to cross-sex hormones and a full transition. So it interferes with that natural desistance process.
And I think, when you look at the diagnosis of gender dysphoria, gender confusion in kids in particular, the diagnosis is made really on perception and feelings. There's nothing objective about the diagnosis. There's a propensity towards, they feel a strong inclination towards. And when you're talking about diagnosing kids around those parameters, it's really dicey, because what 10-year-old knows much of anything about life and who they are? And there's so many kids. I never forget, we had in our old neighborhood, a 5-year-old boy who used to run around in the summertime in his sister's dresses all around us, and he'd play with all the kids. And we thought, that was back probably in the 90s. And we thought, boy, his mom's not saying anything. It's okay. And he just was having fun. And then probably 20 years later, I saw him as a patient. And I said, I want to ask you something. I said, do you remember when you used to run around the neighborhood in dresses? And I said, what was that all about? I mean, did you feel confused? And he said, heck no. I went through a phase where I didn't want to wear underwear, and wearing my sister's dresses felt a whole lot better than wearing pants. There you go. It's so simple. And yet I think that parents are so quick to overread. We want a diagnosis for everything, for every thought and every feeling that kids have. And then we want to be able to push them in a box, and it just isn't fair. So MaryAnne, you interact with kids and parents, and you have concluded that transitioning kids is unethical. Other people would say, no, wait a minute, we want kids to be who they were meant to be, and changing them or not allowing them to feel that way is unethical. Talk about the ethics of this, if you wouldn't mind.
Well, of course, every parent wants their child to be, who they're meant to be. I mean, that's a really noble sentiment. But it's also, when you're talking about, transgenderism, it's an oversimplification of that very well-meaning consideration. And when you look at medical ethics, of course, we need informed consent. I had a knee replaced, and I had to sign all kinds of papers telling me all the risks, right, and the possible to the in the minutia. And so,
Mhm.
with gender transition, you have to talk about not just the biological, but the social and the psychological factors and risks. And it's highly unlikely that a child or an adolescent can really process some of these risks. I mean, if you talk about
Mhm.
biological risk and you're presenting, oh, there may be the loss of reproductive capacity, say, that loss, how does a 12 or 13-year-old actually assess that cognitively even? Or the loss of sexual function so that they can have an intimate relationship, it's just not possible. Or socially, how can they understand that transitioning could cause isolation or the rejection of a family member, or that they may become even a sexual curiosity, right,
Mhm.
versus having a relationship that's genuine. And then, in terms of mental health, the psychological experience, what people have seen, what experienced clinicians have seen, is that when a child is so focused on transitioning that they lose that's all they do is trying to overcome social anxiety and other parts of their life.
Hmm.
So, choosing a career or education or whatever really takes a back seat. And then that produces a whole another group of anxieties. And so I
Mhm.
just don't think that, a child is capable of that informed consent.
Mhm. I totally agree because we know about brain development, and we
Hmm.
know that full brain development and their complete mature cognitive maturation doesn't happen until they're in their 20s. And that's also a great point you made about kids becoming hyper focused on transitioning. That
Hmm.
when they do that, that's all they think about, and they don't think about other things. And in a way, it shows us that focusing on transitioning could be a way to escape other issues that you're having, because if you focus on transitioning, then you're really not dealing with anything else. We need to take a quick break, but don't go anywhere. We'll be right back. Welcome back, everyone. As you can tell, I'm talking with two women who really know what they're talking about. We've taken an intensive dive about transitioning kids, and I strongly urge you to go to the research paper Irene Ericksen and Stan Weed wrote, where they're discussing this topic. Okay, let's continue our conversation with Irene and MaryAnne. Irene, parents and physicians are told that transitioning is good for a child, but you say the research doesn't support that. In fact, there are a lot of harms from cross sex medical treatment. Can you talk about the supposed benefits versus the risk and what the research says about those?
Yes. First, just to talk about this kind of the state of the research. One of the things that these international reviews found, like in Sweden and the UK and Finland, I think was one of them, was that the quality of the research is very low. And, it means there's no comparison group. The sample size is very small. You're making a decision based on a subgroup of 15 kids. So if 3 kids change their score, everything's different. The whole thing changes. There's no, it's self-selected sample. So, and there's no controlling for, confounding factors. So that's one problem. Another problem is that the research now has become so politicized that it isn't reported accurately, or it's misrepresented. And I can give you some examples
Mhm.
of that. And I know this because I've read these studies. So this sounds like, somebody say, oh, well, that's just one of those kind of crazy right wing accusations about,
No, you've really reviewed.
my mantra is you have to read the study. You have to read the study to know what it really says, because if you read the abstract these days, a lot of times the abstract misrepresents what's found. I'll give you an example. One of the most recent studies that claimed to show that these kinds of treatments reduced suicidality in teenagers, they found that suicidal thoughts were reduced, but not suicide attempts, or suicide thought with a plan, or suicide attempt that required hospitalization. All of those, none of that was reduced by these treatments, but it did show a statistically significant reduction in suicidal thoughts. But the researcher didn't, all he reported in the abstract was the reduction in suicidal thoughts, and then concluded that this treatment reduced suicidality when these more credible measures more serious measures of suicidality were not reduced. And in fact, for older teens, the most serious indicator of suicidality actually was increased. But then he was able to do a statistical manipulation that was, could be justified, it was debatable, that allowed him to not have to report that as a significant finding. I suspect him on this manipulation because he didn't report these other important findings in his abstract, and his research is funded by the makers of puberty blockers. This same data set, when it was analyzed separately by someone else, and they separated the biological males and females, found that for biological males, the rate of suicidality was increased, statistically significantly increased. So you can see here how this research can be manipulated, misreported, and that is happening. I'm here to tell you that is happening. So the quality of evidence is low for these studies that claim that there is benefit. One of them, at least, I could go into the details on that one, it would shock you, shouldn't even have been published, but it was published in a journal of the American Medical Association. So, and now it's being criticized by people for these technical, really major invalidating problems that it has. This was the study by Tordoff that claimed to reduce depression and suicidality by 60%. And it wasn't reduced. And the reason it looked like it was reduced was because their comparison group, 80% of the kids in the comparison group dropped out of the study, leaving only 7 kids in the comparison group. They went ahead and ran the analysis anyway, did not report the drop-off in their comparison group, which was an invalidating fact in their study. It should have eliminated their study from publication, and it completely invalidates their results. So anyway, you can tell I get kind of worked up about this, but the evidence of benefits is very low quality. The evidence for harms is actually of better quality, and there is evidence that bone loss, bone density loss, heart problems, infertility, the inability to experience sexual pleasure, which nobody's talking about, but you'd think would be a big issue, for people, some of these people. There are many problems with this, possible cognitive effects and mental health effects, that there's more evidence for an increase in suicidality, as I've looked at it, than for a decrease. So, and this is consistent with what these international bodies have concluded. And even Medicare did a review of this and said, the evidence is not sufficient to be able to determine whether doing a sex change surgery reduces suicide. They couldn't, so there's no evidence for it.
Well, I love that you're taking a lot of this research apart, because the average parent out there would go, oh, well, that study was published in Journal of the American Medical Association, so it must be really good. But that isn't true at all, because there's so much financial bias. You've got drug companies who are, sponsoring these studies, some of them, and you've got a lot of bias in the researcher, and that just nullifies a lot of the research that's happening here. So what you're basically saying is parents and physicians are told that kids need to transition, because if they don't, they're going to commit suicide. And what you're saying is, no, that's not true at all.
No, that's not true. They're told you have to decide if you want a live trans daughter, or a dead son. And the research does not support that. And that is something that I think, MaryAnne, you've called emotional blackmail, and it's what's been driving a lot of this. Is it makes all these proponents of transition, medical transition, feel very self-righteous and virtuous because they are saving lives. And it frightens parents that they have to hurry up and do this transition, or they're going to lose their child. And none of that is supported by the research.
Yeah, that's, I read some in your writing. I wanted to talk about that, the emotional blackmail in there. Oh, I think MaryAnne, maybe you had written about it. What is your experience as far as depression and kids and how it plays into, the whole transgender issue? Because I think that the general belief is if a child comes into you and they want to transition and they're depressed, that the inability to transition or their dysphoria is causing the depression. But that's not necessarily true, is it? You write that it's a much more complex issue. Can you talk about that a little bit?
Yes, it certainly is. And it's actually complicated and it's not complicated. And I say that because there's a lot we know about puberty, right? And what girls in particularly, and they're the ones that are showing this enormous trend toward transitioning. The boys and girls are really, their rates of depression and anxiety are pretty much the same when they're before puberty.
Mm-hmm.
After puberty, when puberty starts, girls are twice as likely to become depressed.
Mm-hmm.
And it's some people, I think it's Jordan Peterson refers to it as the negative emotion network or something. And he says that kicks in for females very strongly when they begin puberty. And there's good reasons for it because the women now their secondary sex characteristics are beginning to show, and there's the whole awkwardness that comes with that and self-consciousness. And now so they start focusing on their social relationships, and then their awkwardness is also translated in how they relate to the opposite sex. And now we're talking about pubescent children here, so we have to keep that in mind. We all remember those awkward years. And girls in particularly have what's called an increase in rejection sensitivity. And I wish I knew that when I was raising adolescent girls, because even a slight, word or look or whatever, they have a heightened awareness to that because of that self-consciousness. So it's really interesting that, we attribute this depression to gender dysphoria at the very time when, girls are going through puberty with all of its chaos and questioning and awkwardness. And so I think that it's misplaced to, not recognize those internal stressors as the cause of depression.
Mm-hmm.
And as Irene said, gender dysphoria is not the root causality of depression.
I am so grateful that you all are here. And if you have time, I'd love to do a second show. Would you be able to continue our conversation?
Yes, that'd be great.
Yeah, that's great.
Well, this has been a fabulous time. And my hope is that you walk away knowing more than just the emotional and psychological arguments for transitioning kids. But now you have solid medical data to back it up. My intention is always to provide you with good data, not just anecdotal arguments or summaries of poorly done studies. I strongly encourage you to go to Institute for Research and Evaluation and read Irene and Stan's entire paper. And please feel free to share it with other parents, teachers, whomever you think needs to read the research. Here are my points to ponder. 1, know your facts. Before you entertain transitioning any child, even if they're 18, slow down. Don't let them rush into anything. This is a complex issue and the solution isn't simple. Physicians in transgender clinics may lead you to think that it is, but it isn't. You can't simply block puberty, add hormones, possibly do surgery, and believe your child will be much better off. It's not that easy. 2, empathize. Whether your child or a friend's child is considering transitioning, empathize with them. Berating them and telling them they're crazy will only drive them to the nearest clinic. These kids are in real pain. They're profoundly confused and influenced by their friends and teachers and other parents encouraging them to do the brave thing and stand up for who they really are. The problem is, deep down, they know that they aren't sure of who they really are. 3, tell your kids to wait. Kids who are dead set on transitioning can always do it later. Friends and psychologists will tell you that transitioning will decrease the likelihood of them committing suicide. But as you can see, the research shows that this isn't true. In fact, when kids mature into young adulthood, 85% identify with their gender of origin. And if they had transitioned, they may be in far more vulnerable state to do harm to themselves. The best advice is to slow down, help the child with his pain, and wait. Give his brain time to mature to the point where it's ready to make life-altering decisions. I want to thank my great guests, Irene and MaryAnne, for joining me today. To learn more on this topic, go to the Institute for Research and Evaluation. That's institute-research.com, or to aSenior, ASCENSION. And their website is capital W, small e, capital ASCEND.org. weascend.org. Now let's review my points to ponder. 1, know your facts. 2, empathize. And 3, tell them to wait. Friends, if you need help or encouragement or answer to any questions about your kids or relationships with them, go to my website, meekerparenting.com. I have courses and tips and blogs and more to help you. And if you know a dad who needs encouragement, while you're there, check out my brand new Strong Fathers, Strong Daughters Masterclass. And always remember, great kids are raised, not born.